pleasure to be here. Thanks so much. Before I talk about the technology we're working on, I'd like to make an analogy to other technologies. In fact, one that most of you have in front of you. The computer. It's a mechanism for us to communicate, for us to innovate. And it's a system. It's a system of small components. And those components are very important. Things like the hard drive, sound card, the chip in the computer, and of course the software and the operating system that goes on top of that. Now, if you are a maker of these components, you can sell them. In fact, we have a place in California, I don't know if you have them out here, they're called Fry's Electronics, and you can go and you can buy sound cards and motherboards and chips and the chassis, and you can put them all together, and you can make a computer. And this industry has been very important, in part because it's changed the way we live our lives, but also in the paradigm that it's set for us. If you're a maker of these components, you can sell them to any computer assembler, like Apple, like Dell, like Toshiba. You don't have to make all of the components in your computer. And this works for a number of reasons. One is for standard connections. Did you ever think about if you go to one of these electronic shops, or if your hard drive fails in your computer, all you need is a hard drive with the same type of connection. You don't have to worry about what that disk is made of. You don't have to worry about the power it needs. All you need, really, is this standard connection into and out of that hard drive. We've got independent devices. So for the most part, these devices function independently. They don't affect each other unless you want them to. You don't have the hard drive moving unless you tell it to in your computer, and that doesn't necessarily affect the sound card unless you want sound to come out of your computer. So these devices function independently. And then, of course, we've got software that allow us to design computers and silicon wafers and all of that. I want to make another analogy. This analogy is to the chemicals industry. This chemical is styrene. It's one of the most widely used and manufactured quantity chemicals. It's used for, of course, styrofoam. It's used for toys. It's used for plastic bottles. And even things like tires have a large quantity of styrene in them. If you wanted to synthesize styrene, you'd assemble a system. This system would be a chemical manufacturing plant. And you do so with somewhat off-the-shelf parts. These are called unit operations in chemical engineering speak, but things like reactors and distillation columns, and you'd connect them all with pipes. Now, this works because we have chemistry that allows us to synthesize something like styrene from something like benzene, which we have a lot of in coal. We have, as chemical engineers, designs for chemical reactors. So if we don't have exactly the right chemical reactor, we can build one. And of course, we can connect all these components with pipes. Now let's just think about pipes for a minute. Did you ever go to Home Depot and buy a pipe? And if you think about the pipe, you get a 1-inch male pipe and a 1-inch female pipe, and they'll screw into each other. You don't have to get 2 Acme pipes for them to screw into each other. All you have to have is standard pipe threads. And that's because someone took the time to set the pitch on the pipe threads. So no matter who the manufacturer is, you can put those pipes together. And this allows us to assemble components like a chemical manufacturing plant very quickly, much like we might do in this computer. So I really want to talk about biologics and how we use biology to manufacture the things that we need the most. And I want to contrast that with the two industries that I just talked about, the computer industry and the chemicals industry. Let's say we want to make a drug, in this case, artemisinin, which is extremely effective against this disease, malaria. Now, let me just give you a little background on malaria. Malaria affects between 300 and 500 million people every year. 300 to 500 million people have malaria. 1 to 3 million people die of malaria, and 90% of them are children under the age of 5. And economists have noted, of these countries shown here in green, that malaria reduces their GDP by roughly half. There are drugs that have been widely used for the last 400 years. They're based on quinine. Quinine was originally extracted from the bark of the chinoa tree. Wars were fought over getting access to quinine, and it's been widely used and abused. In fact, so much so that resistance has grown to quinine and the follow-up drug, chloroquine, in many parts of the world. In fact, there's a story out that the World Health Organization was going to, in the 50s, actually recommend that they put quinine in table salt so that everybody gets a little bit of quinine in their diets. Well, we know what overuse and abuse of antibiotics can do. And this is what's happened with quinine. But there is hope. It's a drug called artemisinin, and it comes from this plant, Artemisia annua. And this plant grows in many parts of the world. It's called sweet annie, sweet wormwood. It grows like a weed, and it has a great history. The Chinese discovered its powers back in 168 BC, where there are writings from the tombs of some of the ancient dynasties that it's used first for treating hemorrhoids, and then later for treating fevers, presumably fevers due to malaria. And then it was pretty much forgotten until the 70s, when the Chinese were fighting in Vietnam and needed something to replace chloroquine and quinine. They went back to their ancient literature, pulled up artemisinin, purified the active ingredient, and characterized it. And we have it available today. And it's produced, as I said, in this plant, and it accumulates in these little oil sacs on the leaves. But the problem with it is manifold. First, its price. A treatment for you as a traveler might cost you as much as $20, and it's a cure for malaria. Now, the World Health Organization realized that that was too expensive for people in the developing world, so they negotiated a price with the manufacturers of artemisinin combination therapies, that is, drugs that contain artemisinin with something else, for about $2.50. And that price has come down a bit, but it's still far too expensive for people in the developing world to afford, who live on less than $1 per day and whose government spend less than $4 per year per person on health care. What's more, the source of this artemisinin is the plant, and it's grown in small farms in Southeast Asia. And when artemisinin was recommended 2 to 3 years ago as the drug of choice for treating malaria, they started withholding the crop so that the price would go up. The price fluctuates wildly on the market, and manufacturers have to plan about 18 months in advance in order to get their supply of artemisinin for their artemisinin combination therapies. What's more, the artemisinin often comes in contaminated. They use the only solvent they have available to them, gasoline. And a few years ago, when they were still using leaded gasoline, there was a real contamination problem. But the bigger problem is that there are manufacturers out there, I call them rogue manufacturers, that are manufacturing monotherapies with just artemisinin. There are even some manufacturers that are putting no artemisinin in their artemisinin therapies, or low amounts. We need to be able to control this, and one way to control it is to produce the cheapest artemisinin available, and then only sell it to manufacturers that are going to use it properly. So the way we're doing this is not through chemical synthesis. There's a chemical synthesis route, and this is how we would manufacture many drugs. In fact, most of the drugs we use in this country are manufactured through this route. But the route is inefficient and expensive. So we're using the power of biochemistry and microbes. In essence, we feed microbes sugar. We have them take it through metabolic reactions that we've manipulated, and they produce the drug. Now, it's not just that simple. In fact, this is a simplified version of what it looks like. These are the chemical reactions we need. And these are representations of genes. And there are about a dozen here in all. that we're going to need with their accessories. In fact, we're going to need about 40 parts to do this. And they're not off the shelf. There's no Fry's Biologics out there where we can go buy our parts, take them home, and assemble them, and maybe for good reason. This is how we get biological parts. We write to our colleagues and we say, I saw your paper, please send me your biological part or device. We actually call them genes. And once I get to answering the email and I pull the strain out of the freezer and send it to them on a plate, I reply, here's your requested device, please use it as we described in our paper. And a couple of months go by and you get an email back saying, it didn't work. And you write back and you say, well, in my hands, it worked this way. And if you do it just like I said in my paper, it should work. And this goes on and on and on. And this is the way we practice biology today. Can you imagine if we practiced microelectronics that way? We wouldn't have any of these devices in front of us. But that's how we practice biology, and it's got to change. Well, as I said, we need about 40 off-the-shelf parts to build this microbe that produces this anti-malarial drug. But we couldn't find those even off the shelf. We couldn't even write to our colleagues and get those. We had to pull them from other organisms, like from baker's yeast and from the plant itself. And sometimes those genes don't work, and so we've got to rebuild them using computational programs. And then we have problems like intermediates, chemicals in the metabolic pathway that the cell has never seen accumulate and kill the cell and don't produce any of our final product. So it's taken us about 6 years to actually get this system to work. But we've come up over 7 orders of magnitude. That's 10 million-fold. And with every one of those increases, we get a drop in the price. Now, this shouldn't be 6 years. This should be 6 months or 6 weeks. And we're going to need that if we're going to respond to new diseases. So my lab formed a collaboration with a company that grew out of my laboratory, Amherst Biotechnologies, and with Victoria Hale's Institute for One World Health. And the concept is simple. We build a bug in my lab that produces a chemical that goes to a company where they specialize in optimizing it, things graduate students don't like to do. They optimize the process, make it industrial strength, and then it goes to One World Health, where they contract a manufacturer to actually make the drug and get it out to people. But there's an important aspect of this that I didn't talk about. Most of the biological components that you get from your colleagues are patented because biology grew out of the pharma industry, where they patent everything and they hold those patents exclusively. And what that means is that if you want to use that technology, you've got to license those patents and you've got to pay huge royalties. Royalties that make the development of drugs for the developing world almost impossible. So we said, okay, we're going to patent everything we do in my laboratory so that nobody can block us from using this technology to help people in the developing world. And the University of California said, and we're going to give that technology away, no royalties. Yeah. This is a model that essentially has been started in the microelectronics and now in the software industry. We're essentially giving these away open source. But there's a cost to that. The cost is that anybody involved can't make a profit on this. We're going to give the technology away, but you can't use it to make a profit. You can make other things with it that you can make a profit on, but you can't make a profit on artemisinin. And it goes now to Amherst, where they won't make a profit on artemisinin. They'll optimize it, but they'll use the technologies for some of the things I'm going to talk about next. And then it goes to One World Health. We are now negotiating with a large manufacturing firm, a pharma company, to actually get this technology out to people in the developing world. Within 2 to 3 years, we hope to have pills in the hands of African children. And we hope to have reduced the cost by up to an order of magnitude for the active pharmaceutical ingredient. But we don't have to stop there. This drug, artemisinin, is a relative of this drug, complicated molecule, called Taxol. It's a very effective anti-cancer drug, and it comes from the bark of this tree, the Pacific yew. You need one 100-year-old tree to get enough Taxol to treat one cancer patient once. You need more treatments than what there are trees on the planet. And what's more, this is a protected species. We could take the genes from this plant now, and all we'd need is one tree, even less than one tree, to get the genes, put them into a microbe, and get it to produce this molecule. Or what about this molecule? This is a molecule that comes from this tree. This is me with a lot less hair. This tree called the mamala tree, and it's a native of Samoa. And Samoan healers found out that it was great for treating hepatitis. And a guy named Paul Cox, an ethnobotanist, learned how to make the concoction from the healers in Samoa. He took it back to the NIH. They purified the active ingredient and found out that it's pretty effective against HIV. It's now going through clinical trials for HIV. If it makes it through clinical trials, what are we going to do? Cut down all the rainforests in Samoa for this tree and then plant them all over? With farms, no. We think it'd be far better to just take one tree, get the genes out, put them in a microbe, and get the microbe to synthesize the molecule for us, and save the rainforest and the hundreds of other molecules that might be in there for curing other diseases. And of course, the wildlife. What else can we do? This is our consumption of energy as of about 2000, and it's growing substantially. Projections are that we'll outgrow our capacity to produce energy very shortly. And in fact, our capacity to produce energy is dwindling. This is production of oil, petroleum, all over the world. And you can see that in the US, production peaked in the 70s, and it's projected to peak in the rest of the world very shortly. On top of that, we're producing a ton of CO2 and putting it into the atmosphere. This is CO2 levels over the last 400,000 years. You can see it was cyclical with a period of about 100,000 years, but here we are today, okay, at unheard of levels of CO2. Well, we think we can actually use these same microbes that we've engineered to produce artemisinin and now to produce transportation fuels, things that you can put into your gas tank. That we can capture all of this solar resource that's underutilized in things like plants and turn it into fuels. Now, we already use this. We use it to produce ethanol, and this is the process we use. We take basically corn, which scavenges sunlight and CO2, produces starch. We break that down into sugars, and then microbes produce ethanol. But it's got some challenges. One, corn takes a lot of energy and water. Energy in the form of fertilizer. And second, ethanol is not actually the best fuel. It's what nature gave us. I like to say that ethanol is for drinking, not driving. It's toxic to the microbes that produce it. It can't be piped through our traditional pipelines. Your automobiles will only take up to 10% ethanol unless you have flex fuel vehicles. And because it's toxic to the microbes that produce it, it's produced in low quantities, and the rest of it is water. So about 15% ethanol, 85% water, and you got to get all that water out before you can use it as a fuel. Think if we could produce and engineer a microbe that would produce oil that would just float on the top, and we just skim it off and pump it into our tanks. This is actually going to be possible using the same technologies I talked about for artemisinin, but now putting in the ability and the capacity to produce hydrocarbons. I think the future is very bright, and I think biotechnology has an important role to play. The unfortunate aspect of biotechnology is that the way we've practiced it over the last 30 years since recombinant DNA is 30 to 40 years is not really going to be the way we need to practice it going forward. We need to think about intellectual property and redo intellectual property. And as Victoria said, we need to put biotechnology to use for people in the developing world, people who need it the most. It's a real pleasure to be able to speak to such a distinguished group and such a fun group. And I really appreciate being invited. And I thank you for your time and attention.